In 2021, the federal government required most medical institutions to post in the U.S. to post their standard charges so patients would know what they're paying up front. But are Oklahoma hospitals complying with federal regulations? A national organization says no, while Oklahoma hospitals dispute the organization's claim. Steve Shaw joins us now with more. Steve.
Taylor, a hospital patient rights group based in Newton, Massachusetts, last month sent us a list of claims they say show most of the hospitals in the Sooner State are not transparent when it comes to what they charge for services. Several of those hospitals tell me that's not the case.
Well, it's really culture starts at the top. These pricing files are pretty easy to post.
Cynthia Fisher is founder of the nonprofit PatientRightsAdvocate.org. They're that hospital watchdog group based in Massachusetts. They say they monitor what hospitals across the U.S. charge for services.
When hospitals and insurance companies hide their prices, they can charge whatever they want. And that has been the case. And 100 million people in this country are in medical debt or have bad credit because of hospital creditors and collectors on huge charges that they never expected to pay.
In January of 2021, a federal agency called the Centers for Medicare and Medicaid Services, or CMS, enacted something called the Hospital Price Transparency Rule. According to that, each of the more than 4,000 hospitals in the U.S. are required to provide clear, accessible pricing information online about the items and services they provide. Fisher says of the 2,000 hospitals her watchdog group has studied so far, only 721, 36%, are fully complying with the pricing transparency rule. In Oklahoma, Fisher says she found only 10 of 43 hospitals they reviewed were fully complying with the pricing rule. That's just 23%.
When patients can see prices, then they can know whether or not they've been overcharged when they get their medical bills. And nearly everyone in this country has a story of themselves or a family member being overcharged by a hospital or an insurance company.
Here's a list of the Oklahoma hospital PatientRightsAdvocate.org says are fully compliant. They include some of the biggest in the state: St. Anthony's in Oklahoma City and OU Health. Fisher singled out the Surgery Center of Oklahoma here in Oklahoma City as one of the best anywhere when it comes to price transparency.
We applaud them. And in fact, they were a showcase, and so many other surgical centers like them have come online to be price transparent, like Texas Free Market Surgical Center in Pennsylvania. There's OSS Surgical Center, and they followed their lead to do the right thing by patients.
Here's the list of hospitals PatientRightsAdvocate.org says are not complying. They include the largest hospital in the state, St. Francis in Tulsa, and the Ascension and Hillcrest hospitals on the east side of the state. In central Oklahoma, they include Integris, Mercy, and Oklahoma Regional Hospital. I attempted to contact every hospital or hospital group on that list. I heard back from most of them. They all claim they are price transparent, and they are following the new federal rules. This was Norman Regional's response. Norman Regional is compliant with law and CMS regulations to provide clear, accessible pricing information online. It is unfortunate this report claims we are non-compliant without specifying what specific practice is non-compliant.
What we see with Norman is they do have a file. They are putting up some information, but the information isn't complete.
Oklahoma State University Medical Center is also on the alleged non-compliant list. They referred us to Rich Rasmussen, who's president of the Oklahoma Hospital Association.
We're going to be compliant, and we're going to do whatever the federal government requires of us.
Rasmussen says the fact only 7 hospitals nationwide have been fined or penalized since the transparency rules began almost 3 years ago is significant.
When this rolled out, there really was no interpretive guidelines that really helped hospitals figure out exactly how to report it, other than we had to have a machine-readable file, other than we had to have these top procedures referenced in it, but not a lot of governance, not a lot of guidance from it.
He'd also like to know more about patientrightsadvocate.org.
Third-party organizations, like the one that you referenced, which like to go out and purchase and aggregate data, they're not the only ones. There are others that will buy the data, resell the data, make money off of the data, or use it to discredit healthcare organizations. They don't interpret it the same ways the federal government interprets it. So for hospitals, we rely on what CMS tells us.
However, State Senator Nathan Dahm, who's also chairman of Oklahoma's Republican Party, says Oklahoma hospitals do have serious price transparency issues. He sponsored a bill last session that would stop hospitals from sending medical bills that haven't followed federal price transparency rules on to collection agencies.
So this is a very broken system that needs transparency, needs some accountability. And so, I mean, this is one of the largest sectors of our economy, the healthcare industry, and there's not real true transparency in it, in violation of federal rule, of state law. So this is absolutely something that needs to be corrected.
Rasmussen says this fall, the federal government will add more specific guidelines, he says, that will further clarify price transparency rules.
I wouldn't say that it's broken. I would say it's complicated. It really is. I mean, when you look at what goes into an average bill, and certainly the information that we're uploading, which individual item costs or individual item charges, there's hundreds, thousands, depending on the procedure that you might have.
Senator Dahm says his bill made it to a Senate committee this year and hopes it gets to a full state Senate next session. By the way, the largest hospital in the state, St. Francis in Tulsa, I reached out to them twice in the past 3 weeks, no response.